Welcome back for the Q&A follow-up to our Tuesday webinar on Medicare for Christian Scientists. Thank you for joining us today. I'm John Mitchell, the Executive Director and CEO for Arden Wood here in San Francisco. As a 501c3 charitable nonprofit organization, Arden Wood serves the Christian Science field first as an evergreen, ever-expanding idea that supports the ministry of Christian Science nursing. It provides a place to receive skilled Christian Science nursing care and to experience healing. As you well know, Medicare is quite complicated, as you've been finding. Hopefully this week's presentation by Jim Maher, Katie Burris, and Nancy Sedan was clarifying and helpful. They are with me again today to answer your questions, and they are available anytime by phone or email to address your specific issues. Their contact information will appear on your screen at the end of today's webinar. One other resource you are welcome to contact is the Christian Science Provider Network, and their website is Christian Science Provider Network, rather csprovidernetwork.org, csprovidernetwork.org. Let me just say again how wise it is to give some good thought to a care plan in the event that a need for Christian Science nursing care arises. If you have such a need, your focus will be on God and healing, not on a stack of paperwork or how to pay for care. Thinking through your options now is absolutely key. Let me also say again that Arden Wood is not advocating for Medicare in providing this information or these workshops. It is simply one choice that's open to you if you're 65 or over, because you've paid into Medicare with each paycheck you've received throughout your working life. Being on Medicare or not does not in any way change the care you receive from our staff. It simply comes into play when you pay your bill. Last but not least, the content shared today is only informational and is not intended to be legal advice. A replay of this webinar will be available on our website tomorrow. Let me introduce our speakers. Jim Maher is a certified senior advisor and broker consultant specializing in Medicare. He's been helping individuals and companies navigate Medicare since 1989. He frequently speaks to law firms, CPAs, medical groups, school districts, Rotary clubs, as well as large and small companies. Jim is also a certified long-term care insurance strategist. Katie Burris is a Medicare specialist, certified long-term care consultant who helps individuals with their Medicare and long-term care planning strategies. He does this by focusing on the issues they face and using insurance products to help protect and preserve their wealth for their families and charities. Katie is a partner at McGrew & Maher Insurance Services and has been in the business for 17 years. She's licensed for life insurance, long-term care, and Medicare in several states. Nancy Sedan has served Arden Wood since 2006 in a variety of capacities, including handling the Medicare billing for 3 years. A devoted San Francisco Giants fan, go Giants tonight. She has been our Director of Finance since 2010. And now, Jim, Katie, and Nancy are ready to answer your questions. Please post your questions on the Q&A icon at the bottom of your Zoom screen. Note that we are the only ones that see your questions. So let's get started. Here's our first question. I only have Part A of Medicare and want to get one of those Plan Gs that you referred to. What do I need to do? Do I need the Part B also?
So in order to get a Plan G, yes, you would have to have both Medicare Part A and B effective. And then any information as far as like pricing or how that works, you can always reach out to either Jim or myself, and we would be happy to help you.
Right. So if you don't have Part B now, right, they have to add it on. There's, believe it or not, Medicare's got another enrollment period called the general enrollment period. So that individual, you can add Part B on between January 1 to March 31st and would be effective July 1st. It would be way too easy if they just said you can add it on any time. So they don't allow you to do that. So therefore, everything, if you add in Part B, would be effective next July, and therefore the insurance would also be effective July. So that's kind of the process, but you can always call us and we can walk you through that again.
And Jim, can I just add that the Plan G, of course, is for a Medicare supplemental policy.
Correct.
And Part B is part of the original
That's
Medicare.
correct. Yeah. Thank you, Nancy.
Great. Number 2, you mentioned RNHCIs or RNHCIs, which is Religious Non-Medical Healthcare Institution. Do all of them accept Medicare?
I guess I'll take that one.
Yeah.
Good question. So the term RNHCI, Religious Non-Medical Healthcare Institution, is a term that Medicare uses to denote facilities such as Arden Wood or other Christian Science nursing facilities that offer Medicare to potential patients. So to answer your question, not all Christian Science nursing facilities offer Medicare, so therefore they wouldn't be RNHCIs. But there are, I believe, 10 Christian Science nursing facilities throughout the country that are RNHCIs and would accept Medicare, and Arden Wood is one of those.
Exactly right. Thank you, Nancy. Next up, I live in Missouri and would like to use Arden Wood. Does it matter if I live in another state?
Nancy?
No, no, we're Medicare will pay at any, original Medicare will pay at any facility, and when I say original, I mean either Part A and Part B, will pay at any facility throughout the country. So yes, it would pay at Arden Wood if you live in Missouri.
And then if you have a Medicare supplement, that would be important to note that if Medicare approves the expense, that the supplement will as well.
Right.
Good
We do
point.
have patients that come from all over the United States that come to Arden Wood. So yes, you're welcome. Next up, I have one of those plans that costs $0.
Okay.
I've been getting billed for a late penalty. That's interesting, isn't it? Can you review how I stop that plan? Do I need to call Medicare?
So no, you wouldn't need to call Medicare. What you would want to do, give us a call and we can kind of walk you through that. But what you want to do is you want to cancel that Medicare Advantage plan. And then before you do that, give us a call and we would want to ask you, health questions and make sure that you could qualify for a supplement if you wanted to do that. We want to make sure that you don't go without having any coverage at all, but we could absolutely walk you through that process because that's important to make sure that you have something in place.
Right.
That's great. You've always said that. I love that. You don't cancel anything. You've got something in
Yeah,
place.
please don't.
Right. Yeah.
Let's look, read it through first and then before any action is taken. Absolutely. Next up, my spouse is in his 70s and doesn't have Medicare Part B. Can he sign up now? Can he get supplemental insurance? Do I just call you for the cost?
Well, first off, you can call us because we'd have to walk you through that. I think one of the previous questions was about how do I add Part B? And that would be during the general enrollment period, like I said, January 1st through March 31st, and then all plans become effective July 1. So in that instance, just reach out to us and we'll walk you through that again. But once you add Part B and it's effective July 1, that's when the supplemental coverage would also be effective, whichever plan it is, G, for example. So we would try and coordinate that and help you because it's just not easy, right? They don't make it easy to understand that. Even John, it's kind of interesting. You'd think you'd enroll through a Medicare office, right? You go out and look around for a Medicare office. Well, there are none. You enroll through Social Security. So that's very confusing also. So just go ahead and call us and we'll walk you through that.
Great. Thank you, Jim. I have one of the Medicare Advantage plans, but want to make sure that I can stay at Arden Wood. I want the plan that covers me if I do stay there. How do I drop Medicare Advantage and get Medicare? I believe I would be covered and pay $0. Is that correct?
You want to start on that, Nancy, or are we all kind of jump in?
Sure, maybe I'll just start with the Medicare Advantage plans are officially supposed to pay at a RNHCI. They are required to pay any benefit that original Medicare Part A or B covers. And so technically a Medicare Medicare Advantage plan should pay here at Arden Wood. However, what we have found is that because the Advantage plan expects that you're going to work with just their one insurance company, a Kaiser or a Blue Cross, they expect you to have gone to a doctor and have had a diagnosis. And of course, you wouldn't have done that. So when you come here and we try to get, you have to get an authorization from your Medicare Advantage plan to be here. It takes quite some time. Our nurses have to be on the phone a long time to try to help them understand that indeed you don't need to provide that information because you're at a RNHCI and a Christian Scientist. Anyway, it takes quite some time. And then on the billing side, it's just as hard. So we are, the simpler way is if you could switch to Part A or Part B, but it is your decision.
Right. And we agree. We just want people to know the facts, right? A lot of the calls we get are, we would like to stay at Arden Wood or another RNHCI, and is Medicare better? And I think it's better in terms of they want to make sure that it works for Arden Wood also. Most Christian Scientists are concerned that you get paid also. And I think was the second part of that question about, was it Plan G? I forget. It was.
No, we had asked something about would they pay zero? Was that correct?
So most, if they have a Medicare supplement and they're come in through Arden Wood, for example, under the Part A side, most of the Supplement G that we were talking about or even in, they would cover that, right? If it's approved, they would have no copay, so they would pay zero. Versus if they just have original Medicare, then you have to deal with that $1,484 deductible and then those copays per day. And I think the example we gave Nancy in the presentation was somewhere around $57,000 without some type of a supplement, right?
If they had an extended
I think it was an extended
If they had
stay.
an extended stay for
Right,
150 days, right?
Yeah,
Which doesn't
so-
happen
so-
all that often, but it is a
Yeah.
risk. Yeah.
So I think it makes a lot of sense for people simply to look at a supplement. It's much less costly, and I'd rather pay whatever the premium is and know I don't have to pay anything if I come in. So that would probably be our recommendation.
And part of the question was, so how do I drop Medicare Advantage and get Medicare? So that's with this enrollment period.
Right. Yeah, that's what you can do during this annual election period, or again, they call it the open enrollment period. That's when you can reach out to your Medicare Advantage company. You can drop the plan and go back to original Medicare. And again, John, it's really, we want to make sure that that we can get the supplement for them at the same
Right.
time and kind of coordinate that. So we always want to talk to those individuals
So
before.
yeah, before they do that, just
Right.
give us a call, and we want to make sure that there's a transition there and not
Right.
left with
And-
not having anything.
Right.
And when
Yeah.
again is that annual enrollment period?
October 15th through December 7th.
Right. And then everything. So that original Medicare would start January 1 for them in that example.
So
So-
Medicare Advantage plans can be dropped between October 15th and December 7th.
Yes. And it'll be effective January 1st.
Starting tomorrow. And one thing that we've also talked about is, at least as it relates to a Christian Science nursing facility like an Arden Wood or a RNHCI, as we're calling them, a registered non-medical, religious non-medical healthcare institution, they're really disadvantaged plans for us, because I can just say from my perspective, the staff spends untold hours getting authorizations from Advantage plans. They are very difficult to get into or even get reimbursed from them. Think up 1, even 2 years, Nancy, right? I mean, sometimes it takes a long time. So
Yeah.
think of yourself as providing a service, whatever your business is, and not getting paid for 2 years.
Yeah.
It really is a disadvantage from our perspective. Next up, is it better to have just Medicare and no supplement? I have the means to pay if I need to stay at Arden Wood. I'm not sure if the supplement plan would be worth it. I'm very healthy and I'm in my late 70s.
Well, that sounds familiar. I get a lot of calls. We get a lot of calls like that. So Boy, Nancy, what do you think? I mean, that's without, well, they would have A though, right? So they'd have inpatient there, but they would pay that per day cost, the deductible.
Yeah, I think there are a couple ways to look at that. I think, it's a financial decision and it's unique to each individual situation. And that's where Jim and Katie can help you think that through. But some of the factors involved are you would have to pay a premium for the Medicare supplemental as well as Part B if you didn't have that already. So that's a cost. That's a regular cost you'd have every year. And you weigh that against the possibility of having to pay co-insurance and deductibles if you needed to have a stay here. So you pay it over time and have no risk, or perhaps pay it when and if you needed it. So it's an individual decision based on your assets. And as Katie and Jim have said before, there is also the additional benefit of having the Part B not have any opening in terms of extra cost.
Right. Okay. Yeah. No, we agree.
And some of these things, like we've talked about before, this is where the decisions that one is making, it's nice to include family members, because family members are going to want to know, mom, dad, auntie, grandpa, how are you planning for this? What are you thinking about? And I think having answers to those questions would not only satisfy the individual, obviously, and their spouse, but also their kids and grandkids.
Right.
I know one other important thing to mention, kind of piggyback on that, is with that deductible and the costs, that is not like a calendar year cost. It could be multiple times in one calendar year, because it's that benefit period where, Nancy, you talked about last time, where when they go more than 60 days since they've received care, they could be subject to a new deductible and copays if they were to be admitted again.
That is true. Yeah. That's true. John, you know what? We talked yesterday, maybe this is a good time to bring up the healthcare directive again, and how important that is when you're talking about family members, correct?
Yes. Nancy, you want to handle that?
Sure. So the Advanced Healthcare Directive is a legal document that allows you to designate your wishes with regards to healthcare should you be unable to make those decisions for yourself. And so it gives you a chance to think ahead of time. What is it exactly that what type of care would I want, and who would I like to be making those decisions for me? And so this is a document that has multiple choice things for you to think through, but it is helpful to have that in place so that should something come up where there is a need, you have already discussed what your wishes are, you have a loved one or a professional that's going to carry out your wishes. So that's it. And also we have a template on our website, ardenwood.org, that you can use as a starting point. If you're not in California, you may need to make some adjustments for other states. But it is something that you could look at and get as a sample, and perhaps work with your own estate planning professionals.
Exactly. As Nancy mentioned, it's on our website, ardenwood.org, and I just looked at it. You can click on it on our homepage. I can't emphasize enough how important this is. And I know that we've shared that document with all other Christian Science nursing facilities throughout the country. So that's perhaps on their websites if you're in another state. But you just can't emphasize enough how important it is, and how important it is to have access to that document so that someone can find that document. That it's not squirreled away somewhere, but that whoever your loved ones are, they have ready access to it. And if you find yourself, perhaps there would be a claim of accident, an automobile accident, and you say, well, no, I don't really want to go to, in our case, it's San Francisco General. I would like to go to Arden Wood. That might not happen because the EMTs and so on, they're directed to do what they're directed to do. And so their instructions might be take them immediately to CPMC or to San Francisco General, whatever, but it enables you to get out of that medical facility without an advanced healthcare directive. It is extremely, extremely difficult to get out of that situation. So it just fulfills your wishes in terms of the care that you would like to receive. Is that a fair way to say that, Nancy?
Indeed, indeed.
That's good. Yeah. Hey,
Great.
John, and just to, that I was thinking when you were saying that, because sometimes people think, well, if I go to the hospital, right, it's going to be covered under Part A of Medicare. I think one of the previous questions was about adding Part B. It's important for people to understand that if they take them to an outpatient, San Francisco General, for example, to emergency, and they're there a few hours, that's covered under Part B, as in boy, of Medicare. So that's why it's important. I mean, if you don't have insurance in that, I mean, I don't know how astronomical the bill is going to be, but with Part B, you kind of know ahead of time, listen, if I just have Part B, even a no supplement, I have a $203 deductible, and then I'm only going to be charged 20% of the Medicare approved rate. So at least you have some type of buffer. Medicare is the buffer there. So emergency room, outpatient surgery, or if you received an MRI or a CAT scan while you're in there, that would all be covered under Part B. So when I go back and think about that question, should you get Part B? I think that's a pretty good reason to have Part B, quite honestly.
Yeah, the costs associated with that type of situation are well beyond what most Christian Scientists are aware of. It's hard to describe. And again, in terms of getting out of a hospital, we've had situations where people have, through no choice of their own, been taken to a hospital and literally had to move heaven and earth to get out, to get an advanced healthcare directive signed and authorized and so on, because the hospital will say, no, you can't leave until we have something like that and know for sure your choice of care. It's complicated. So that's why you have a plan.
Mhm.
Okay, next up, I have a John Hancock long-term care plan. Will that help at Arden Wood? I also have a supplemental plan, N as in Nebraska. I won't say Nancy.
Oh,
Supplemental
not
plan,
Nancy,
N.
okay.
Would I be better off just having Medicare?
Gee, well, Nancy, I don't know, do you want to tackle that one, or do you want us to jump in? Or?
That's a really great question. I'll just start, but I'm going to turn the both of
Okay.
it off to you. So anytime you hear long-term care in a policy name, that is not going to cover you or coordinate with a Medicare policy. So they're two different things. And then the most important thing to know with a long-term care policy is you need to make sure that it has a rider, what's called a rider, that will actually pay at a Christian Science nursing facility. Otherwise, it will not pay here because we're not licensed in California, because we don't dispense medicine here.
So you're accredited, you're just not licensed in the insurance world. Just to piggyback on that Mutual of Omaha question, no, it was John Hancock. I'm
John
sorry.
Hancock. Mhm.
I've seen a lot of those policies that Christian Scientists have sent me, and there's no specific verbiage. Sometimes people may have been, I don't know, what do you want to say?
Misleading.
Well, sold something they thought they were purchasing to stay at Arden Wood, for example, and they were told one thing and the policy says another. So I always tell everybody, send me a copy of the policy, but you want to look on there and see, like Nancy, is there a Christian Science rider? Or the best bet is if you have a true indemnity, which means cash. The insurance company pays you, and then you could use that money in turn to pay, whether it's Arden Wood or your grandchildren to mow your lawn or your neighbor to take you out to lunch, whatever it is.
That gives you the ultimate freedom.
It gives you the ultimate freedom. But I have seen policies where people assume they had a Christian Science rider on there, and we didn't see it in the policy. So you really have to be a good consumer and really look at that.
Yeah, and we've talked about this before in terms of most people, from your experience, Jim and Katie, really haven't read through the policy in great detail. And
Yeah.
that's when it really is important to know what is in that policy.
Mhm.
It's the fine print that
It's
gets
a
you.
fine, it's a fine print. Right.
Exactly. Next up, my husband and I both have an HMO plan that does not let me start over. My husband and I both have an HMO plan that does include the prescriptions. We don't use the prescriptions and don't really use the plan. We bought it just in case we needed it. Should we keep it or get one of the Medicare supplement plans? We are in our early 70s and quite healthy. It is confusing to hear all of the advertisements about these different Medicare plans.
Yeah.
So that again always boils down to, a personal decision. But if you are not using that plan, you're not using the prescription coverage, and where you want to receive care is at Arden Wood or another Rinky that accepts Medicare, then really that's probably not the best plan for you.
Right.
And so we could always have a conversation with you and just
Right.
help you decide like what makes the most sense for you and what is going to fulfill what you want to accomplish.
Great. If I want to stay at Arden Wood, do I need to have a Medicare plan? I only have Part A now. I want to make sure I do the right thing. Should I get the extra insurance? How much does a policy cost?
All right, that's a good one. Very good. No, you do not have to have a Medicare plan in order to receive care at Arden Wood. John mentioned that in his opening remarks. However, you probably have been paying into Medicare all your life through your paycheck, so it could be useful to you. You would automatically have the Part A. I think your question said you had Part A, which is great. And let's see, what was the rest of the question? Should you get extra insurance? And so that's what we've been talking about in terms of a Medicare supplemental policy that would help you cover the co-insurance and deductibles. And so that's the same thing that we've been discussing. Would you like to put another slant on that, Jim?
As far as pricing, that's something that we could absolutely help give you the cost of what it would be, so you could see if that makes sense.
Right.
And that cost changes based on age, is that correct?
It depends on the state, but normally that's true, Nancy. It ticks up every year with age normally. So we look for companies out there that have really good rate stability. And might as well just say, I'm a big fan of the AARP United Healthcare because of their stable block of business. I think they have 4.5 million people on their plans, which gives them, they're able to maintain price integrity. In other words, they're not raising it 15 or 20% every year like I've seen some insurance companies do. So that's one of my favorites, quite honestly, because they just do what they say they're going to do and they maintain their rates, but they do tick up with age normally every year.
And we do work with multiple different insurance companies. So some of them have different ratings based on different areas or ages.
Well, that's true.
Like
Yes.
that.
Some have like an age band, like they'll go 65 to 67, 68 to 69, things like that. So we try and look at all that. But again, we want companies that are very stable, that they're going to pay the claim, right? Do what you say you're going to do and that's so important with insurance, because I see people all the time, well, I'm going to buy the cheaper one. I'm like, listen, cheap always comes with a cost later on. Don't buy cheap, right? Buy a quality plan with a good company, and know in the back of your mind that, like in California, you can actually change every year with your supplement. We won't want to go into that, but that you still can do that if the rates keep going up. They do allow you to change once a year within 30 days of your birthday in California.
So I can also confirm that we have had patients that have had AARP supplemental plans, and they do easily pay.
That's good.
And anytime one has original Medicare, the supplemental is going to pay automatically.
Right.
So that's always a wonderful thing from our point of view. And also, just to clarify, maybe, Jim, when you're looking at different companies and you're giving them something to choose between, it's true, isn't it, that the plans are all identical?
That's
right. The
They're
letters are different, but you're comparing apples to apples with these different.
That's exactly right, Nancy. So we're talking about Plan G. Plan G is the same with every company in California. It doesn't matter, most throughout the United States. The Plan G, the benefits are identical. The only difference would be the insurance company and the premiums, right? So that's why you want to have a good, solid company with a reasonable premium, but they are identical.
And that's where Jim and Katie can be so helpful to be able to get you those options at the in one phone call.
Perfect. Next up, I have a Medicare plan through CalPERS. Maybe you can explain CalPERS. And I'm not sure if that would pay at Arden Wood. How do I find out? Can you review my policy and tell me if it's covered?
Yeah, so CalPERS is the public employer retirement system. So a lot of people in California retire with CalPERS, and they have lots of options when they retire. And it's very confusing for everybody, but basically original Medicare is going to be the primary payer. So if I came into Arden Wood, for example, Medicare, Nancy, is still going to be the primary payer. And it's just going to be a different supplemental plan through CalPERS, whether it's Anthem, Blue Cross, HealthNet, United Healthcare, whoever it is, that would be the secondary payer. So it's nothing more than a benefit offered through CalPERS, but I would encourage people to look at, the cost of your policy. Sometimes I've seen the same benefits offered in the individual market for half the price. So you really want to be a good consumer. Just even with its CalPERS, you have to be a good consumer and look and see if another plan would be more beneficial for you.
Boy, that's helpful. Next up, I purchased a Mutual of Omaha long-term care plan 10 years ago. Would that pay with my Medicare at Arden Wood? How do I know which one pays?
Oh, that's a good question.
So that's always going to go back to if it has that Christian Science rider, and Nancy, I'm sure, can speak more to that than we can.
Right. So the rider specifies that indeed the policy would pay the benefit at a Christian Science nursing facility as it would at another assisted living, a hospital area. So, but if it doesn't have that rider, then it won't pay. So it's very important to look at that policy, and you folks will do that for them if they wanted you to take a look at it.
Sure.
That's great. And just to clarify, in terms of the Medicare, how Medicare views us, and to qualify a claim that would qualify for Medicare, think of it as if you went, this would be the equivalent of a Christian Science hospital, if you will. If whatever the claim is, if it's something that you would be brought to a hospital for, it'd be something that would qualify at an Arden Wood or a Christian Science care facility. So that's kind of how it's viewed in terms of the claim. Is that a good way to describe it, Nancy?
Yes, excellent. And I would just add to your sentence that's what would qualify for Medicare.
Right, that's what I meant.
What you were just describing. And long-term care would not be a claim that qualifies for Medicare.
Exactly.
So that's why there's two separate types of policies, one that covers Medicare type level care and long-term care. So they're two separate things.
Exactly. I'm worried about what the cost would be if I'm at Arden Wood for a long period. That figure of over $57,000 is frightening to me. I live alone and have Medicare. Would it be recommended to get one of the policies you were referring to in the presentation?
Again, that's a personal decision. I'm a proponent of paying a little bit to have that zero figure if I had to go in, and whether into Arden Wood, for example. It's a personal decision. I know we've gone over it a few times. Nancy, what do you think?
It's a wonderful question, and I think it's part of this whole planning process. You think it through for yourself, what you're comfortable with. I would say, everyone is expecting quick and whole healing. We expect and are looking for a short stay. And I'm grateful to say that, many cases are like that. But there are a handful or two where having coverage for a longer period of time really met their needs. So I can see it both ways.
Okay.
Indeed. I watched the long-term care presentation. Is it more important to have a plan like that or Medicare? This goes back to some of the things we talked about. If I choose to stay at Arden Wood, I have Medicare but no additional coverage. Is it prudent to have both?
So that's where Nancy really brought up that they're really two different types of care. And so, and that's where we could go into more detail with someone, because the Medicare stay versus the long-term care,
Right.
they're just completely different things to think about.
Right.
Yeah, that's a whole different discussion and a worthwhile discussion. Next up, if I don't have Part B coverage and want to add it on, who do I call? When can I get that and the Plan G you were showing? I don't want to worry about that high amount if I come to Arden Wood or another facility.
Right. So that's kind of interesting. We should probably talk more about this general enrollment period, which is January 1 through March 31st. So that's when you can add Part B on, and you do that through Social Security. You're probably going to call them, and you know, the easiest way is just to call our office and we can kind of dial you in on how to do that. But again, when you activate Part B, even though you sign up for it, it's not active until July 1st. So that's again when any of the other coverage, if you still wanted it, that's when that would also begin.
It should be noted that if you have only Part A, but you're still working for that employer with 20 or more employees, then when you go to retire and come off the group plan, you could get Part B at that time. So
Right.
that may be kind of more of an individual conversation
Right.
we have, depending on what your status is, because it could be that you're still on like an employer's plan or something like that.
Right.
Great. Next up, I've had Medicare Part A since 2006 when I reached 65. My question is, how much will the cost be for Part B and Plan F, including penalty?
So Plan Part B this year, it's $148.50 for about 94% of the population. If you're on Social Security, they automatically take that out of, we used to say a check, now it's a deposit, right? So you get that. Plan F really depends on really what area you live in. If you're in Northern California versus Southern California, it's less costly up in Northern California versus Southern California, or it depends what state. So we can, if they call us and we just need your name and zip code and date of birth, and we can pretty much tell you what the cost would be for Plan F.
And then as far as Part B, you would pay that, more than likely that $148.50, but there would be some sort of penalty if you haven't been on that employer plan. And then it also depends on when you were 65, did you have an employer
Right.
plan
Yeah,
for a few years?
That's a good point.
So the
Yeah.
bad answer is it depends.
Right. Well, and that, the Part B penalty is 10% for every 12-month period that you should have had it and didn't. So that adds up quickly. But what Katie was saying, so if I should have had it at 65, but I had Part A, but I was still working for a company and I didn't come off until 67, those 24 months or 2 years are still protected. I don't have a penalty for that period because I was on an employer group health plan. So.
And I think the other scenario is, okay, let's say they weren't, and I think the individual said 2006 is when they qualified.
Boy.
So that's 15 years.
Yeah, that's
so
a big penalty.
15 years times 15, about $15 a year penalty.
150.
And that would be added to the 148, right?
Yes. Yep. And that pays every month for the rest of your life.
Yeah.
Yeah, it adds up. Next up, is it appropriate today? And please, some of these questions are somewhat repetitive as we've learned, but I'm reading them as I get them and editing a little bit, but there are too many that I don't have the ability to sort through. I'm trying to get everybody's questions answered. So please go along with me on that. Is it appropriate today to ask about supplementing Medicare with long-term care insurance? How does it work and how does it integrate with Medicare? We've kind of addressed that one. So, but.
Right.
So, and I know in past presentations, Jim's talked about, so with Medicare, it's normally like a short-term stay, like, Nancy said. With long-term care, the qualifications to get that covered are those, they call them activities of daily living. So when you get up, if you need help eating or bathing, dressing, stuff like that, and normally like it's going to be like a long-term situation. It's not something where you're going to go in and get the spiritual healing in a short amount of time. So that's where they're really different in that instance.
Right. But that is confusing. I get
It's so
people, I get
confusing.
all the questions on long-term care and Medicare. Medicare, right, national health care, you've got to have it when you turn 65 or the government will fine you. That's kind of how it works. Long-term care would be an add-on saying, listen, if I do end up in a facility, not just Arden Wood, but if I do up in a facility, I want to have the means to pay for that. The Medicare doesn't cover, and I don't want to drain my family's assets. That's kind of how to look at it. Maybe.
Or even receiving care at home.
Right. Yeah, that's true. Yeah, you always want to stay home when possible.
Here's a little bit of a longer one. I want to ask further about long-term care, particularly in relation to RNHCI facilities. I'm asking from the perspective of one carrying parts A and B, along with a Medigap policy. From talking with our local Christian Science nursing facility here in Dallas, Texas, they are not subject to the specific limitations that apply to medical facilities, such as length of stay limitations, meeting certain progress standards, et cetera. Not seeing the same need when relying on RNHCI facilities of a need for long-term care coverage. This is really a statement rather than.
I think that was a statement, right? That was pretty educational statement.
Okay. Here's one that we get a lot. Nancy, I know I've talked with Nancy about this. I have SCS, or Serving Christian Scientists insurance, SCS insurance for Christian Scientists. Can you comment on that?
Sure. Serving Christians, SCS, Serving Christian Scientists, is a company that offered insurance policies that were specific to Christian Science needs. And there was a variety of product. Sometimes they paid a certain amount per day. Sometimes they paid practitioner bills, those kinds of things, depending on what policy was chosen, even as much as acted like a Medicare supplemental. They are no longer able to offer new policies, but if you have one current that you've been paying your premiums on, then it is still active and it will still pay. So I'm not sure what the specific question was, but that's what I know about SCS. I actually even spoke with them today and just reiterated that they answer the phone and they handle claims regularly.
Great. Can you give us an idea on how much supplemental plans cost?
It's kind of like saying I want to buy a car. How much does a car cost? It really depends on the zip code you live in, the county, the state, and your age. That's the key information we need. And it's age-based. So normally the older you are, the more it costs. But still, I mean, I'd rather pay in if it's $130 or $140 a month to get a plan, that if I did need it for care and they're Part A, that I have a zero copay. I don't have to worry about it. That's just my take.
A lot of the Plan G, like at least in this area, the Plan G usually runs about 130 for someone 65, and then it goes up every year after that.
Exactly. Another question. I live in Colorado and we have Wide Horizon is our care facility. They have not chosen to use Medicare. Are you also certified in Colorado?
Us? Oh yeah, no, we're licensed in Colorado. Yes, yeah.
Great.
So that sounds like that would be more of a long-term care conversation than anything
Yeah.
at that point.
Since they don't have Medicare, right?
Right.
This is one slide that we show, I believe, at the end of this presentation. It says, please advise on location of all Christian Science RNHCI facilities or religious non-medical healthcare institutions or RNHCIs. We'll have that list at the end. There are 10 in the United States at present. So we'll show that at the end on a slide. On Tuesday, it was mentioned that Washington State was changing a law that will affect supplemental insurance. Can you please clarify?
So that's actually on long-term care, not on the supplemental insurance. So the law states that you must have a long-term care policy if you are currently working. If you are not, then they're going to sign you up for that plan effective November 1st. And they do that through a payroll deduction for every time you're paid from November 1st until you retire and stop being paid.
And I just read a big article today. Guess what? Other states like Oregon and California go, gee, that was a really good idea that Washington required. So if you think about it, it's kind of a buffer, right? A lot of people, not Christian Scientists, but maybe they look to Medicaid or in California, Medi-Cal for help. So that kind of creates a year buffer in those plans. And so I know other states are looking at that right now. So I'm fearful that they're going to follow down in Oregon and California, right down the West Coast. So.
And what that Washington plan is, it covers for a year, and it covers, I believe, $100 a
Right.
day. So
It's not very good.
It's a very limited plan, but they're trying to make sure that people have something in place.
Right.
Right. Let's see, this is a little, what is a supplemental plan F? And then is one covered by the medical if a non-science relative takes one to the hospital? I have part A and part B.
Right. Yeah. Medicare is accepted in most all hospitals. It's hard to find a hospital that doesn't accept Medicare. So the answer would be yes. And then that supplement plan F would pay 100% for inpatient. So if they go inpatient, just like plan G, you would have no copay. Whatever Medicare approves under part A, you'd be covered in full, whether it's a Christian Science facility or a traditional hospital.
We reference G more often than F, because F, you have to have been 65 prior to January 1st of 2020. And then what we've seen is some Christian Scientists, if they have the option, prefer G because it's a little bit cheaper.
Right.
And the deductible on the B side, a lot of them are not anticipating
Right.
using that as often as they might the part A side, the hospital side.
Now, we talk a lot about A and B.
I know,
and G and D
a lot of
and
letters there.
Seriously.
Here's a good one, kind of a tricky one. I returned to the United States last spring after living abroad for 40 years. I tried to file for my compulsory Medicare, and I was told I was too late. When can I file?
Did you say 4 or 40, John?
40.
Oh, wow. So first thing you want to do is call Social Security, right? They're going to go over all the details, 800-772-1213. And you're going to want to call them and find out what the details are. You may not qualify for premium-free Part A even. You may have to, because if you haven't paid into the system, they say 40 quarters, basically 10 years of full-time work, then you're going to have a share of cost also on the Part A. It's not going to be premium-free. So you want to call Social Security right away and find out.
And that was one of those slides we went over on Tuesday, where we talk about you have to have either been a U.S. resident or,
Right.
or a U.S. citizen or legal resident for the last 5 years to qualify for the premium free.
And I have had clients, that to move and they go, Jim, I just had one that was over in not Hong Kong, I can't remember. And he said, listen, I'm over here working, but should I sign up for Part B? And I said, absolutely, because if you come back in, if you don't sign up for it, you're going to be penalized. Because he goes, I'm working there now, but in a few years, I'll be 68. I want to come back in and make sure I have coverage. So my recommendation was go ahead and pay for the B. So when you come back in, you have both A and B set up and there is no penalty.
And that's a conversation we can obviously have with the individual, because it can be
I just thought I'd throw that in there because we're rolling. So, okay.
Here's one. I currently have Medicare Advantage PPO through a state health benefit plan with United Healthcare. I would like to switch to a Medigap plan with Plan G. How do I get started? The plan book looks complicated.
Yeah.
Also, can you estimate the additional cost would be for North Carolina?
So again, it's all based on age. So they can always give us a call or send us an email, and we can at least give them an idea of how the plan would work, what the cost would be, so that they can really look at it against their current plan.
Right. The difference between a PPO and original Medicare has no network. I get that all the time. They go, Jim, I want a plan, as good as a PPO. A PPO is a broad network, right? A preferred provider organization where that's usually good nationwide. Well, original Medicare is better because there is no list. You can go to any provider, healthcare facility, hospital that takes original Medicare, so it's better. And then the supplemental cost, it really depends what the PPO cost is. And that's where we just come in and do an analysis. And yes, we are licensed in North Carolina. So
great. I have have had Medicare Part A and B and Supplement Plan G since 2017. The prices have gone up about $800. Should I shop around for better prices? Do I do this during open enrollment?
So it depends on the state you live in. So every state has different options as far as when you can shop the supplement plan. In California, it's within 30 days of your birthday. But that's where you would want to reach out to us, because depending
Right.
on your state, there's different rules when you can look at other options, but we can help with that.
Right. A couple states have that 30-day birthday rule. To make it more confusing, they expanded it to 60 days, so which is better for the consumer. So if my birthday is October 14th, I can look at making that switch now and having an effective November, December, or even January 1st. Remember, that same plan G is the same with company ABC or XYZ. But $800, that seems
That's really high.
That's really
You
high.
would definitely want
Yeah.
to evaluate that. Yeah.
Yeah.
Mhm.
That's worth the call. How does one change PCP name? I don't know what that means, PCP. name.
primary care physician.
So if you have a
wait.
plan that's asking you for your primary care physician is a Medicare Advantage plan.
Oh, great. Okay, because I just want to finish the question. Sorry.
Oh, yeah.
For where I am, as I am soon to move to Oregon from Washington State. Sorry to interrupt.
Right. They would contact the insurance company and say, I want to have another primary care physician. So in the non-Christian Science world, right, that's the HMOs all work off a primary care provider. So they're kind of like the gatekeeper doctor. You go in and they refer you out. So that's real simple. You just call your insurance company, notify them of the move. It'll qualify you to also change plans if you want, but that's the easiest way to do it.
You would definitely want to talk to your insurance company before you move, in case they don't offer that plan that you're on currently in the state that you're moving to. We happen to live in a state where we have quite a few people moving out of state, and then they notify us after they moved, and we have the issue where the insurance doesn't follow them. So that's something to consider.
Good to get these questions answered. What's the difference between N and G supplemental plans?
Okay, without getting too technical, and there's different kinds of doctors, right, or providers that take Medicare and assignment, meaning they agree to take whatever Medicare pays them as payment in full. With Plan N, like Nebraska, not Nancy, they can balance bill you up to 15%. It's called a limiting charge, a limiting fee. So I like G because you never have to worry about, gee, excuse me, Dr. John, do you take Medicare? Do you take assignment? Oh no, you're cash only. It just makes it easy for people.
G doesn't have that distinction.
Right. G doesn't have that distinction, and N's probably always going to be a little bit less costly or cheaper, but remember, you get what you pay for.
This leads into the next question. You have suggested buying Plan G. I'm leaning towards N. The only difference I see is excess fees, which I see as potential at medical facilities, but not at Rinky facilities.
Correct.
Mhm.
Yeah, that's true. So that's a statement. Yeah, that's exactly right.
Perfect. This is a question. What is supplement HI-F or high F?
So they do have some supplement plans that are less costly. So let's say example, a traditional plan F would be a $150 premium, for example. A high deductible plan F may be $60 or $70 a month, meaning you have a very high, let's say a $2,200 or $2,400 deductible. So you pay less, but you're going to have to pay that $2,400 out of pocket. And once you hit that ceiling, then you're covered in full.
Great. Okay. Do you have to be a member of AARP to get AARP supplement policies?
Yes.
You do.
Help us clarify what care, quote unquote, at a Christian Science Rinky provides. Are long-term care, assisted living, Christian Science nursing care, and independent living all provisions at a Rinky? And which, if any, are covered by the different Medicare plans? Good question.
That's a Nancy question.
Yeah.
Okay, let's see. So Medicare covers Christian Science nursing at the Medicare level, and that's the only thing that Medicare covers at a Rinky. Remember that Rinky is a term that Medicare has coined for Christian Science nursing facilities that offer Medicare. Can you repeat the question? The rest of the
Sure.
part?
Does it apply to independent living or assisted living at a Rinky?
So
Medicare.
the answer is no. You don't need insurance, obviously, for independent living at all. And assisted living, here at Arden Wood, we have what we call sheltered care, which is could be considered similar to assisted living. And sometimes long-term care policies that do have a rider will help assist pay for the bills at the sheltered care level or assisted living level.
Great. Medicare does not pay for a practitioner. Will it, if it's a conjunction with an Arden? Let's see, Medicare does not pay for a practitioner. Will it, if it's in conjunction with an Arden Wood stay? I see.
No, it will not. It does not pay for Christian Science practitioner costs.
One thing, Nancy, can you talk about the National Fund for Christian Science Nursing as one source of support?
Yes, thank you. It's the National Fund for Christian Science Nursing is a wonderful organization that supports any Christian scientist who is wanting to use Christian Science nursing to support their healing, whether they're at a Christian Science facility, whether they're at home, they will evaluate in a very simple way your financial position and determine what they can contribute towards a bill that you might have for care, either nursing care or even practitioner care. They will also cover. We've seen many patients, whether they're in the assisted living program here at Arden Wood or receiving Medicare level care, or even light nursing, which is would not qualify for Medicare. All of these patients qualify for National Fund for Christian Science and Nursing help, if indeed their finances justify that. And we've just seen so many people be blessed by that, and we're extremely grateful for the fact that it exists. It's the kind of thing that you would have your direct relationship with them. You apply to them. They have a wonderful website at NF, National Fund for Christian, nfcsn.org. You could check that out. And people tell me that they have just a wonderful staff there that is very nice to deal with.
Truly. Thank you, Nancy. Next up, what is the policy where you pay into a fund regularly and can use the funds to pay healthcare costs as you choose? If you never use it, some of the money can be refunded. It's not available in my state as of last year.
I'm not
familiar with that.
Like a healthcare fund.
So like if you had a health savings account, that would be monies
Right.
that you, right, like a medical IRA, isn't it? That you could use those monies for whatever you want, care or.
Right.
Right.
With an HSA, you can't have that when you're Medicare eligible. So
Right. But the money's
yeah, I
in
mean-
there, you can use for Medicare premiums after you retire. So
Interesting.
yeah.
Maybe that's what they're referring to in that question. Yeah. Last question, actually, that's good because we're coming up to 5 o'clock. I retired on September 30th of this year. I'm now covered under my wife's company healthcare plan as a spouse. I have Medicare Part A. Do I have to select Medicare Part B to avoid the Part B penalty? Or am I exempt as long as I'm covered under my wife's plan?
Yep.
as long as your wife's plan has 20 or more employees, then yes.
Yeah, you're covered, right? So you don't have to worry about a Part B. When you come off the group plan, you qualify for a special enrollment period, so you're going to be fine. No fines.
Great. And the clarifier from our friend said it's a health savings fund, that's the right name for it or right term. Great. Well, that appears to be all of the questions. As you know, we will list everyone's contact information at the end of this webinar. So thank you, Jim, Katie, and Nancy for guiding us through Medicare as it relates to Christian Scientists. Please don't hesitate to be in touch with any of the three of us or three of Nancy, Jim, and Katie, or the Christian Science Provider Network with Medicare or insurance-related questions. We are all happy to help. Remember to download a copy of the Advanced Healthcare Directive. I can't emphasize that enough. And fill it out. And the most recent Medicare handbook is available on our website as well. Very informative for Christian Scientists. We are offering a second Medicare webinar in mid-November. So that's still during the enrollment period. It will repeat much of what we've been saying this week. So please invite your friends, fellow church members, extended family, anyone who would benefit from hearing about this option. The dates for the two Medicare webinars are Tuesday, November 9th and the 11th, Thursday, the 11th at 4 p.m. Pacific. Next Tuesday, October 19th, is the fourth webinar in our 6-part series on estate planning. The topic is charitable remainder trusts. Please sign up today. And finally, please mark your calendars for our online only Christmas celebration titled Sing for the King. I love that. On Sunday, December 5th at 2 p.m. Pacific. We hope you'll share this invitation with family and friends and maybe even watch together. Details will be posted shortly on our website and mailed and emailed to you directly. So thank you again for joining us today, and goodbye for now.
Thank you.
Bye-bye.
Bye.